Welcome to this discussion and demonstration of zero trust data to improve healthcare. Very lucky to be a partner of AWS, and we have a chance to work with Hector Rodriguez, who's their subject matter expert on healthcare. He is truly an industry leader. A lot of people follow his insights. What we'd like to do today is really, get some deep insight from Hector on what's really going on in the healthcare space in terms of the challenges. And then we're going to look at, what can be done in AWS, including some new tools that you may have not heard about or seen about. So with that, Hector, thank you for joining our
Welcome. I'm happy to be here, and it's been a long body of work and experience ever since the HIPAA law was finalized in 1996, and then we started to try and implement it a few years later. I was a middleware developer for healthcare organizations, working on those HL7 and X12 interfaces. And when you're in the middle, you see a lot. You see a lot of what's going on at the provider space in the hospitals, with the health plans, with the life sciences organizations and the pharmas. But you also get to start to discern patterns in some of the challenges. And HIPAA itself is a privacy law. It was designed to protect the privacy rights of all of us as healthcare consumers, as patients. And that privacy is about the data. And since the beginning of time, probably data protection has been a challenge, data privacy, but also understanding that the patient is the data, the patient owns the data. This concept of data ownership, who owns the healthcare record, who owns the patient data, has been booted around forever. And I always argue that I'm the patient, it's my data, I own it, and I am the originator of it.
One thing that we can all think about is creating a roadmap for healthcare providers that I guess first moves them into the cloud, then leverages AWS to improve their cost structure and workflow, and then provides them a foundation to do kind of more patient-centric. Because obviously it's a big jump to go from your legacy system to a next gen system where you can get your record on your phone. I mean, I think a lot of people have the same vision. So, I
Well,
mean,
it's funny that you show your smartphone. A smartphone is nothing more than a portal to a cloud, to the cloud, a bunch of cloud apps. If you're using any of the transportation services, Lyft or Uber or Airbnb, Zoom, we are in the cloud. Email and browsing the internet, that's all cloud computing. So everybody is basically in the cloud. Uh, most people know it, some people don't, and even some organizations. But back to your point, organizations need to fundamentally adopt a more strategic approach to how they're going to modernize and migrate into the world of what's really just modern technology and modern computing. Cloud service providers like AWS have very rich and supportive programs for migration from on-prem into cloud. Here's another reality. Healthcare, in particular healthcare, but across other industries, we live in a hybrid multi-cloud world. We live there today, we're probably going to live there forever. So we have to think about that in the strategy. Now, there is an opportunity to say, this is our main cloud provider, and this is where we're going to do most of our work, but you can't discount others. Because patients bring their apps, clinicians bring their apps, and you don't know what cloud that app is working on. Now, cloud providers like AWS do a great job with, again, with partners like XQ and others, of making sure that we are following the rules. And I mentioned earlier, our cloud is built to be secure.
so at this point, I'd like to invite Tryon, and what we want to do is basically show our audience a few tools in AWS which are available to healthcare providers. These are tools that allow you to do backup of records, very practical stuff, but far more simpler and secure than doing it certainly in a legacy data center. And moreover, we want to basically provide a glimpse of the records which are captured in the system, which not only help with compliance today, but actually create a foundation for new emerging services, such as providing the actual patient a log file of who's accessed their data and where have they accessed it. So kind of truly revolutionary. So, so with
Well,
that, oh,
before you do the demo trying, though, I do want to comment on what you just said, because this is exciting to me. This is what excited me about meeting XQ late last year, and the work that we've been doing and the discussions we've been having over the last year is the fact that, again, let's go back to foundational fundamentals. Let's put the patient back in the middle. Everybody says it, but who's really doing it? And that means, to your point, as a patient, I want to have visibility into how my data is being used. I want to know where it's gone, who's using it, why they're using it. And I want to make sure I have consent and, again, visibility. But also, one of the other things that you mentioned, just backing up healthcare data into the cloud, but making sure that it's immutable, that it's read-only, that it's very protected. In today's world, healthcare is under attack by ransomware attacks or other type of security events or cybersecurity events. And it's really creating large-scale issues in the industry where it's actually become a patient safety issue, and so anybody who can help solve that problem, be part of that solution, is very welcome to the conversation. So with that, Tryon, I will hand it to you. I'm excited to see the video, the demo too. So
Awesome. Thanks, Hector. Just as I kind of get into it, I'll kind of kick it off with our Vault product. This product can be utilized to encrypt all of your data on site before you essentially store it in the cloud, where data will be stored in encrypted state. In this demonstration, I'll do a demonstration with data going to S3. This data will actually sit fully encrypted in S3. And then again, as Hector was mentioning, one of the key elements of this is all access events are logged and it fully visible, and these can be provided then patient to identify that X doctor has accessed your records at this time, and then the patient can be confident that no bad actors have actually accessed their actual healthcare records. And then I'll kind of bounce into our secure gateway product, which will encrypt essentially your data migration from on-site to the cloud, as well as kind of data access events from on-site to the cloud, and as well as encrypting all your IoT devices that you currently host in the hospital to ensure that that communication of that data being stored is also transferred in encrypted state there and logged as well. With that being said, let me just quickly share my screen here. So this, again, is one of the things that's unique about XQ that differentiates us from existing products out there, as we provide the end client all the necessary tooling in place to encrypt and decrypt their data themselves directly on their edge device. So what this means is that none of your data or none of the patient's data ever crosses our hands at any point. All of the encryption and decryption events happen locally. The keys and policies are stored within a key store and a policy server. This key store and policy server can be hosted individually by the actual hospital themselves. So that essentially takes XQ completely out of the equation if the hospital wants to control everything, including patient data, as well as the encryption keys associated with this data. Here, doing an example, I'm going to connect as an end user to actually my S3 bucket that I have identified here on the left-hand side. One thing that you'll notice just right off the gate, you'll notice that these initial files that I have here are all kind of XQF types. These just help identify that those files are stored encrypted within that actual S3 bucket themselves. As I connect this Vault product to the actual S3 bucket, what this will do is it'll spin up a virtual file system that'll look identical to your local file system. So you can interact with data as you normally would. It's just all the encryption and decryption events are happening on the fly in the back end here. So let's say I'm uploading a patient record and I want to store this record into S3, or I'm uploading a large amount of patient data and then storing within S3. S3 kind of provides you this redundancy that you need as a hospital to ensure that your data exists there at all times when you need to actually get a hold of it. And XQ ensures that edge encryption before data is transmitted and stored within this S3 environment. Example here, where I'll encrypt all of my web traffic going to kind of this a web proxy, which will filter out all the personally identified information. So all of my data encrypted from on-site to the cloud, which is hosted in an AWS EC2 instance, will get transferred securely using the gateway, at which point within the cloud instance, my personally identifiable data will be stripped out completely, and then my traffic will be forwarded on to essentially the end destination here. So I'll pull up kind of a simple example of that here, where I'm going to open up. So I have the gateways running here, and then I'll open up a web browser where all my data will be funneled through these two gateways. You can already see them creating keys for this information. So now, for example, when I go to Google Maps, it'll have no idea where I'm actually located. It doesn't know anything about me as an end user, as all of that data is stripped out. So I can do all the same searches I normally would. So let's say I'm looking for a hospital here. When I look for a hospital, it'll just grab me random hospitals. So here I can grab portal. So within this management portal, you can drill down into the individual communication logs. So here, for example, that patient record X that I've just uploaded, you can tell exactly the full who, what, where, when for each individual access attempt. So you know exactly that I'm the one that accessed this record at this time, at this location, and then that data was essentially accessed by me.
So we saw a couple of things here that I don't know if healthcare providers know that is possible in AWS. You saw everything from the bulk transfer of data from site to site, where we can lock data down. So healthcare providers have the confidence as they move data from their data center to AWS and back and forth, they have full control, and they have cryptographic control, and then they have a log of movement. We saw the patient files, individual files, each file with their own encryption key and logged separately. So this means when somebody wants to look at a file, that file has to be individually unlocked, which creates a record. We also saw, demonstrating things like IP addresses for medical apps that you might be running in AWS, where we can basically lock down or replace the patient's IP address with the AWS virtual machine address, which so it totally hides the real identity of the patient. But the important thing is the healthcare provider knows it. So if they need to log that, what's this patient really at home, they have those. So, would kind of love your thoughts on some of these capabilities and what you think they might mean for people in the healthcare industry in terms of reducing their costs or giving them new capabilities, or more importantly, thinking about AWS in a new way that, it's just not a cloud. There's a lot of value add.
Well, and it's not just a cloud. That's a great statement. If you're looking to move to the cloud just for the sake of saying you're in the cloud, that I would challenge all of us to rethink that strategy. What we're really talking about here is modern transformation with real purpose, and the real purpose being to enable healthcare organizations to better serve their patients and community. All of the things I mentioned earlier. But what's exciting about what you're doing, and as we talked earlier about zero trust principles and the need to verify, to have verified access, verified permissions, and AWS has services that do that. But when you're doing it as you move data, as you create these files, as you encrypt them, and again, you're constantly verifying the person who's making that access request is who they are, who they say they are, where they say they are, and so on. So we're starting to really bring in that concept of zero trust. But what I look at your solution and say, now we've got zero trust data, which is a great phrase. And I love that concept and what that possibility starts to look like.
If you're interested in seeing any of this, please contact us and we will be happy to provide you a detailed briefing and live demo of zero trust data in AWS, doing everything from doing site-to-site secure file transfer, locking down patient data, and protecting very sensitive geolocation